We're going to turn our attention to a topic that I know a lot of you deal with within the organization, and that's cyber insurance. Um, with that, I want to welcome a friend and colleague, Dan Bowden, who is Global Chief Information Security Officer for Marsh. Notably, he has been a healthcare CISO in his past, and so he has a unique perspective into how healthcare CISOs and the cyber team can strengthen their security posture, but importantly, their insurability through effective controls against breaches and minimization of impact of those breaches. Dan, thank you for joining us. We always appreciate your perspective, and I'll turn it over to you.
Thanks very much, Lisa. It's a pleasure to be here. Great to see some old friends online, and I kind of was trolling through the participants list. So it was nice to see some familiar names and faces, and happy to have a chance to be here. Carol, do you want to cue slides or do you? Okay, there you go. I see it starting up here. And with and you can I think Lisa gave me a good enough background on Meet the Presenter. We can skip to the agenda slide here, and I'll walk through. Maybe go back 2 slides, please, Carol. Thank you. And I'll walk through just who Marsh is and what we do, and then the Cyber Risk Intelligence Center is a part of Marsh that we have developed. We have data scientists, people who have worked in cybersecurity industry in different sectors as threat hunters. They've worked for some of the major EDR firms that you've heard of, cloud security firms, former CISOs, a couple of, besides myself, a couple of former healthcare CISOs are associated with the Risk Intelligence Center. And what they do is analyze a lot of prevailing research data that's publicly available, but also analyze claims that we see and break that analysis down by what goes wrong, why it goes wrong. We have those breakdowns by sector. I'll talk briefly about our cyber risk buyers study insights to give you some idea of what we're seeing, where investments are going among clients and across various sectors globally, and then wrap up from there. So Carol, if you'll jump down 2 slides, I'll talk a little bit about Marsh. Um, so this so this slide right now, I produced it and it officially went out of date this morning, and I don't expect that any of you hover over news about Marsh, but we announced a rebranding this morning. Now we're just Marsh, and so, but I'll give you some insight to my role in these 4 companies and how we work together. The 4 companies listed below. Marsh is a global risk advisory and insurance broker. They insure every single line of insurance coverage that you can think of for businesses. So there's a decent chance, probably I would say a 50% chance at least, any of you on this call, your organization is or has been a client of Marsh. Guy Carpenter is a reinsurance carrier. Mercer does consulting, and some HR people generally have heard of Mercer, and they do a lot of consulting on health benefits, career, wealth, and recently we've gotten into the investments space with Mercer. And then Oliver Wyman is a management consulting company, and the 4 companies work together, try to complement each other as much as possible. But there's been a major rebranding that's just happened. And my role within the organization, I'm the Marsh McLennan Global Business CISO, and there's each of those companies you see listed in the blue box have a CISO, and those global CISOs each report to me, and we help manage the overall security program for the organization. Let's go to the next slide. And this is just a little bit of background. This is a sort of just the what when Marsh tries to explain what we do and who we are, it's not specific to just cybersecurity or a particular sector. But when I think of what Marsh's capabilities are, they're capable of analyzing claims for any given thing that can go wrong to an organization in any part of the world. It could be simple things as natural disasters. It could be political issues, military conflict, economic issues, cyber issues, you name it. And we have this ability to analyze the background and give ideally in the future, I'd like to see us develop into an organization that can even give sort of predictive information of a given event that's disruptive in a given part of the world and predicting what the outcome and what the impact will be for other organizations and for our clients. And so I mentioned that I think and the custom results, what I love about that is in the cyber area, we actually work very hard to give our clients a very specific guidance on what they can do to manage their risk posture as well as be more insurable. Let's go to the next slide, please. So this is just kind of the definition, how we look at cyber risk. And it's interesting what we try to help, and I'll focus on that the building resilience. But one thing that I see us do is the managing phase. I'll talk a little bit about that here. There's a lot of folks who say, well, how much investment should I make in which kind of tools? And what should I expect in insurance? And I expect to pay for insurance. And this is what Marsh is working very hard to explain better for all of our clients is what's that right mix? And while a given insurance broker or carrier may say, you may think that their incentive to say just buy insurance. We all know that's a bad idea. And I think maybe we saw back in 2020, healthcare in particular, 2020, 21, and even back to the WannaCry days in 2017, the carnage that played out, it ran a lot of carriers just plain out of the market because they learned they didn't understand how to price the cyber insurance market. And so there's a lot better data now, thanks not just to Marsh as a broker, but the other brokers. And some of you may work with some of our competitors. They're also working very hard to gather good data and help you understand how much to invest and where to invest in controls, and then what's appropriate to do that risk transfer option into insurance. All right, let's go to the next slide. I'll talk about the Cyber Risk Intelligence Center and some of their findings. Let's go to the next slide, please. And one thing I love about the way they define and they publish their research in the Cyber Risk Intelligence Center is they give a weighting of signal versus noise in the findings. And I'll briefly describe a slide. I didn't include it in this deck. But one of our data scientists is a hockey fan, and he kind of used this analogy that people tend to rate the success or skill of a hockey goalkeeper based on the goals against or goals allowed. And he was thinking the analogy, well, if a hockey goalkeeper were a cybersecurity control, is goals allowed the right measure? And when you take all things into account in a hockey team and strategy and the way they play and how many shots a goalie faces, maybe goals allowed isn't the best measure. So he gathered more data about all of these hockey goalkeepers and kind of flipped the analysis to who would have the most saves over time, and then used the concept that that's what we look for in cybersecurity controls is if all things were as even as possible, what controls result in the most saves? And a save being we're able to avoid a breach scenario and understanding the incidents happen, but which controls do that? And this is that idea of what should be prioritized. And so if you go to the next slide, you can see some of the outcome of some of the more effective controls that we found. And we've done, you'll see a couple of comparisons in a slide or two where we'll talk about what the prevalence and adoption of particular controls and the difference we've seen from 2023 to 2025. But you can see it says most of our controls analyzed in the previous report are now more widely adopted. That's good news. And the important thing is that second part of the sentence where it says shifting the focus from whether a control is in place to how it is deployed. And that's always been a popular question people have asked me is, well, Dan, someone paid for the top-notch EDR. How do you know that they deployed it properly? And what we've seen in our research the past 2 years is there is now more focus on not just paying for the technology, the solution, but also making sure that it's deployed in a more effective manner. And you can see we list there's obviously several controls, but some of those that have been prevailing among our clients is incident response planning. So not going to bury the headline. I'll be talking about that a lot in this discussion. EDR and MFA are now basically table stakes, logging and monitoring, cyber awareness training, patching and vulnerability management. And so these are things that we've seen that have been have a high impact on how likely an organization is to have an adverse cybersecurity incident. So let's go to the next slide, please. And you can see here we did some research and looked at implementation rates of controls. And implementation, while it has a straight definition, as I mentioned, sometimes there's a subjective assessment of what qualifies as being completely implemented. And as I mentioned, we've seen a lot of improvement in that. And you can see some interesting statistics. Patching high severity vulnerabilities, we were seeing only a 24% adoption in 2023, and that shot to 89%. And then where you jump down and look at patching critical severity vulnerabilities from 53% to 89%. And what I've noticed in globally is there now are some of the resilience frameworks that are requiring certification for entities to which that framework applies. And I'll give you an example. UK businesses are subject to what's called a cyber essentials certification. And it obviously takes a survey about controls, but the last step before you get your little cyber essentials sticker is they want to see a vulnerability scan of all the assets that you declared in place. And we're starting to see that prevail more in particular regulations and frameworks. And we think that's how the big part of driving the increased adoption for patching and patch management. And then the interesting one at the very bottom, desktop, organization manages desktop local admin privileges via endpoint privilege management. That one's kind of stuck. I suspect it will start to go up. And those of you who have worked on a security team know that's not an easy one to do. But there are a lot of vendors and solutions out there, but we're hopeful to see that start to pick up, and we're trying to add more focus on that with our clients. And I also lump, for those of you that work in organizations that develop their own software and use Git repos, etc. I in a way tend to lump secrets management down there and would encourage all of you. You can call it vulnerability, or you can call it a credential, or just call it secrets management. Definitely, things we've seen. That's a prevailing thing that's coming up as well, is leaked or unmanaged secrets in repos that organizations didn't know their developers were using. All right, I think I'll just let you eyeball the rest of that one for a minute, but we will probably refresh this again in 2 years and ideally show a compare and contrast as things evolve over the next 2 years. All right, so kind of get to I guess a little bit of the punchline. Let's go to the next slide. Our evidence of what we're seeing that organizations that have the most success in avoiding a serious incident or a breach, this is where they're spending their resources is in these areas. And I'll, as I mentioned, I'll spend some more time talking about incident response planning, but these other controls are things that are very important to us, very important to organizations as well. And you can see, you can argue EDR is related to incident response, SOC is related to incident response, and even cyber awareness training is related to incident response. And I'll dig into the planning portion of incident response later in the presentation. And to go to the next slide, I'm this is just a bar. I won't spend a lot of time. It's just so it shows how we that signal strength. If you look up the axis on the left, and you can see the scale there, though those numbers are pretty small, but we just wanted to talk about, on incident response, this is the signal strength. And maybe we get a little bit carried away with data here, but I'll let you just have a moment to read through those the differences because I think at first blush you may not see a difference, and then when you think about how you manage an incident response program, some of those will become more apparent. But I tend to look at on the left being a little more mature on actual uh, definition of processes and procedures, and then playing out all of the actions associated with it.
So
All
Dan,
right.
do
Yeah.
you have on that last slide any concerns about the lower number of organizations that are conducting these tabletop reviews? Because, that's something that we encourage. Uh,
hmm
in terms of signal strength, I'm not sure, what it indicates, but it's definitely lower than a lot of the other activities.
Actually it's crazy. I would say if you've got cyber insurance, I would be shocked if your broker
Right.
allowed you to buy it without an included tabletop exercise that they'll orchestrate for you. And so if you have cyber insurance and you haven't done a tabletop, I would definitely call your risk, your internal risk officer or whoever manages your insurance and get a hold of your broker and get that done. But it's a great
So,
point, Lisa. Everyone should
yeah.
just
So your point also, though, is, leverage your broker to help you actually do that.
yes. I gave an example in another discussion. I can't remember who I was talking to, but they see all of us in the trenches. It's stressful and there's things going on. And and even if we have access to a broker and cybersecurity services, it's smart to ask the broker, like, what should I do? Who should I use? And I remember once a very simple incident that I was very confident my team had closed out, analyzed perfectly, but I wanted some follow-on assurance. So I and back then I was a Marsh client, so it's funny to me. I'm telling the story about Marsh, but the Marsh broker, our broker, told me, "Hey, you should use this firm to do the incident follow-up and forensics." And I said, "No. I want to use this other firm because I just talked to them recently, and I think they're up and comers." And she said, "No, Dan, those guys are terrible. You don't want to use them." And I got in a big argument and said, we're paying for this. I want to do it. And even our outside counsel recommended we not use the one I liked. And the one I liked flopped. They got it done, but thank goodness it wasn't critical and that there wasn't an ongoing incident because they were terrible. And I did end up apologizing to both our broker and our outside counsel for me really kind of in a kind of an ornery way, disregarding their experience, which is very good. And you remember those brokers, they see incidents fly in every day from
Right.
different clients. And so they know when they give you a hard recommendation, hey, CISO, there are these five incident response options in your that you're covered for. We recommend using this one. I would go that way. So yeah, and tabletops, if they haven't approached you and aren't bugging you to do a tabletop, maybe it's just because the message is going to the wrong person.
So I have an off the wall question in terms of incident response and what your broker can provide. I often get asked about ransomware negotiations, and um, is that something the broker can help with as well in terms of, do you pay? How do you pay? Those really awkward and but very impactful questions.
No, great question. I would work that into the tabletop as well. And when I worked with Marsh, then they helped us with the tabletop. I said the punchline of all of this, everyone wants to hear the CEO answer the question. Will you are you going to pay? And I said, so that's got to happen. But then I think your broker can advise you on how to do it if there's a way to properly pay a ransom. Discussion with law enforcement, the FBI, the steps involved, and reality of how long it actually takes. It's not a magic transaction and everything is just done. You may want to still have your CTO rebuilding all of the infrastructure while the CISO and general counsel are off and CFO are off figuring out how to get your encryption keys. But law
Ah,
enforcement generally can advise you, is this the kind of threat actor who will play ball with you and really give you your encryption keys back? And that's why I would say call the FBI. And people say, well, that's
oh.
crazy. They'll tell you not to. And I'll tell you other stories on the side about how helpful the FBI might be. But they take a long time. So
So we have a question from the audience. How do you, Marsh, determine the cost of the insurance policy? Is it based on just the questionnaire that they complete, or do you come in and do an independent assessment of their security posture?
great question. Today, it is all self-attested. And however, we are asking the questions better at better depth. So your first time, if you've never done one of the questionnaires from one of the brokers before, the first time out, I will admit it's onerous, and it won't just be you as the CISO. You'll want to gather the privacy officer, the CTO, possibly general counsel to get involved, and everybody will probably take a hand in completing it. And at the end, there is often, when it comes down to they may get you on a call with all the carriers. And now you're with your broker and 10 carriers, and the carriers are going to dig into, well, what did you buy for MFA and how did you deploy that and how hard, and so there'll be a Q&A that will often vet out how far you actually went in light of what you attested. And then at the end of the day, if there is an incident and the incident makes it tragically obvious that the control wasn't in place, then I imagine that most brokers and carriers probably have some sort of an out on coverage. Now, back to how it's priced, and how much does it cost? All of those things are relative, and it's what you want it's kind of like your car insurance. What kind of deductible do you have? What things do you want covered? Do you want full coverage? And so there is still that little bit of you going down the menu of what you want and how much flexibility do you want in the event of an incident to pick your options. And so all of those affect what the retainers are and what premiums are.
Okay, thanks. And that's it for the questions for now. Thank you.
All right. Let's go to the next slide. So I'm hoping if you trusted Greg's QR code, you'll t trust mine. If it feels weird being a security guy and throwing a QR code on the screen, but if you're interested in our signals documentation, where we connect controls and incident outcomes, I think that takes you to a website and then you can download the document. So I'll pause for just another 2 or 3 seconds and let you look at that. All right, Carol, and I think Carol probably you can share that to someone later if they still need it, or they can buzz me and I'll get it. I'll talk now briefly about our buyers study, and I want to break down and give a little bit of nuance in incident response planning, and but we'll dig into that, and I'll talk about what incident response planning is and give an analogy relative to healthcare, which those of you who work in the provider space, this is just it's complete common sense, but for others, it may be new. Let's go to the next slide. And I kind of took, hey, let's talk about IR planning. Incident response is a big process. There are a lot of things that are applicable, and I'm talking about if you look at that purpose, you establish the blueprint for handling cyber events, and it happens before the incident, and it talks about all of the things you do to prepare. And if you work in some organizations actually shoot videos and do pre-canned messages in the event to prepare for an incident. If we had this kind of incident, what would we want to immediately say? Well, what's messaging that we want to get out? And that helps organizations respond in an orderly manner and give them a chance to kind of catch their breath. But you can see some of the key activities, policies, playbooks, defining severity levels and triggers, roles, responsibilities, align with business continuity planning and DR, legal compliance, and the analogy I give here, those of you that work in hospitals, there are codes that take place, and a cyber event really you can follow that same model, I would say, because to me the planning is in effect the same for different codes that happen in a hospital scenario. And I won't spend a lot of time going through it, but Carol we'll kind of click through these. Let's hit the next slide. The kind of an analogy of, there's like the code blue is all the ultimate, concern, but in cyber you can call whatever your cyber event that you want, but they're both high stakes, time sensitive, and there's a required disciplined coordination. Let's go to the next slide, and I'll just kind of briefly chop through these. And there's roles and responsibilities defined. Everybody has a job. They know what their job is, and there's someone who has oversight and kind of that takeaway. Everyone knows their lane, and discipline over improvisation. We're not making up things as we go. Next slide. Um, and again, there's timing that's important, and a cadence that's important in order for a successful outcome in an incident. And takeaway is, time's the enemy, speed and clarity are the antidote. And in a cyber event, frankly, one thing that is different, sometimes you do need to slow down a little bit to get clarity. And I think that's well understood for those of you that have managed incidents. Next slide. Situation awareness and escalation. In There's this concept of, how can we detect early, isolate fast, and escalate smartly. And that's something in cybersecurity incidents that you kind of figure out based on risk tolerance internally. What are we going to call the CEO about and when? And when we have an event. And that's something that you should practice on incident response planning as you go as well. Communication discipline. Let's go to the next slide, please. I'm reading my notes ahead of you, Carol. Sorry about that. But the closed loop communication obviously prevents mistakes. And it's great to have a plan that defines who says what, to whom, when, and how. And then, the takeaway is that, miscommunication causes all kinds of problems. And, I remember, I guess it's probably been 5 years back, watching, there was a health system that was under a pretty lengthy ransomware event that shut down their services. And frankly speaking, watching from the outside, the communications I saw coming out was a little painful to watch. And I know it was a great lesson learned for me and my organization. Let's go to the next slide, please. And then there's let's see, where am I? Oh yeah, I'm jumping ahead. Sorry about that, Carol. Post-incident review, everything that happened, why did it happen, and how do we manage it better next time? And I think those of you that have worked in healthcare and some of you been on the actually worked in provider-oriented lines or as a provider, know how important this is. And in incident response for cyber, we want to just find a way, I think, to model that. And that's what I encourage as well. It was a great lesson I learned while I was in healthcare. And let's go to the next slide. Drills and simulations. This is back to the tabletop plug for cybersecurity. Get your CEO involved. There is no better way to learn and understand the risk tolerance of your CEO than to have them in there and have to field the question about what will they do to restore services. And I explained to a lot of CISO friends I have who've never been in healthcare, and I think it's common sense, but they forget why are healthcare organizations so prone to paying the ransom? And I said, well, if the systems are down, every minute that clicks by, things get less and less safe. And then that's generally the ones with some good common sense that immediately clicks and they go, oh yeah, I get it. And I said, also, health systems are still in the US, while some of them are pretty large, they are still very local. And the providers and the administrators of those health systems are likely to be very close to some of the people and patients that are impacted. And so, but in the cybersecurity world, please do your tabletop exercises. And if you don't have a red blue team, it's good to find a way to budget an advanced adversary simulation each year to find out what things can be improved. And the takeaway is the first time you run your plan shouldn't be the most important time. Or shouldn't be the real thing. Regulatory parallels, these are common sense. I think you've seen all of these both in healthcare and in cyber. And regulators now are upping the bar to more proof. And then let's go to the next slide. I think obvious mission alignment and the idea is to serve patients well. And honestly, there's now a connection between cybersecurity and technology being available and the ability to serve patients and keep them safe. And so they now I think they've fully converged in our world. And then go to the last slide. Just two easy bullets to remember. And it's just an important thing to figure out how to get IR planning put in place in your organization. And like I said, I think healthcare is built for IR planning in cybersecurity just because healthcare does IR planning in so many other scenarios that can happen. Let's go to the next slide, please. So just a little on the incident response buyer's perspective. What we've learned, and partially is this exposing this information to our clients as well. It is trending to a top priority. There is no way to stop things from happening. There will always be an event that turns into some kind of an incident. The challenge is finding a way to disintermediate the impact of the incident in a time frame that mitigates or prevents adverse impact to your health system and to your patients. And dedicated budget for incident management, breach response services. You can attain those through retainers in your cyber security insurance policies. And update plans, conduct tabletops. We beat that one up pretty good, but as I said, there's no better way to understand the risk tolerance of your leadership than doing that and having those conversations. And the question on the side, is healthcare part of the study? Yes, it is. And you when you back on the QR code, you'll see also I think some breakdowns for healthcare. And healthcare still, I believe as of last year is are the sector that we have with the highest number of claims. Interestingly, U.S. healthcare, that definitely in the U.S. healthcare is definitely the highest sector for total claims. I don't know why Canada is lower. It's not the highest sector. Healthcare is not. I think it's like fifth or sixth place, which was interesting to me. I haven't figured out why on that, but it could just be how insurance is marketed as well. And and go to the last slide, kind of wrapping up here. Um, it's I think I pretty well relayed the importance of this, but it's a foundational effort, and I think in previous years we focused a lot on preventive controls, which are important, and but now we've got to with the advance of some of the threat actors that are out there, and if any of you do homework on some of the threat actors like Scattered Spider and others, the barrier to entry as a threat actor has dropped drastically, and the tools that they have at their disposal are improving. And so I think it will be, even with outstanding protective measures, it will be impossible, from a practical perspective, to assume that you'll never have any incidents. You're still going to have someone who tricks one of your people, who find a vulnerable point in your network and find a way to exploit that. And so, number two, I mentioned, we're seeing more proper deployment of security controls rather than just buying it. That's always a good conversation. Hey, we bought CyberArk. Let's say I use that example of the kind of poorly trending control for privileged access. We paid for this, or Beyond Trust, or whatever your favorite privileged access management tool is. Did we ever finish deploying that? Are all of our service accounts in there, all of our administrative accounts, etc.? And then final point, to drive the point home, incident response planning is a big deal, and encourage you all to do your best in your organization to continue improving that at each step that you can. And that's it for me.
Thanks, Dan. I think that was very, very informative. I have a question, and not that, AI has been a theme of this entire session, but in terms of, how Marsh looks at things, right? And from
Mhm.
two aspects. One is deployment of AI in the clinical workflow, and then the other is the use of AI tools in defensive posture on the cybersecurity side. Like, how are you guys looking at that? How are you assessing it? Is it already in your questionnaires? And, what are the implications long term? And I know, it's a process you're going through, but just interested in your insights there.
It's really interesting. We talk about this a lot internally, and we get asked by clients all the time, and they kind of start, is AI a new threat? And I think our posture evolves as we learn more.
Right.
Currently, what we would say is AI accelerates and sophisticates current threats. In and of itself, until it becomes sentient, so to speak, it's not running around on its own, but it is back to that barrier for entry. It's getting people, making people who otherwise wouldn't have been a threat actor. And so from that perspective, and like in terms of some of the new AI security controls,
Right.
there are, I would say, break down what is AI, what are we doing with it, and you'll kind of solve, do I need an AI tool, or do I need something that can monitor an MCP server or an MCP infrastructure? And for those of you who haven't dug very deep into it, that's what would support your agentic capabilities. Is you generally have an MCP server, so say, hey, well, what can I use to manage security around MCP? And I'm still debating, is that just another API, and so, but those are the great questions to ask. Do I need an AI developed tool, or have I just not finished deploying the tools I have? And then in terms of clinical workflows, great question. I've felt like it's been there for a long time. It's finally maybe having its day in terms of usefulness to the providers. If you remember, those of you that have been in healthcare go way back when the EHR vendors came out with decision support, right? And it
Right.
splashed all of this stuff in front of the provider, and it was they're looking at their watch and they've only got 3 more minutes with the patient, and hey, I've been doing healthcare for 10 years. I'm just going to tell them to take these antibiotics and go home and rest, right? So and so I think it's evolved, it's getting better, but in the workflow of current tools, I don't think that we've come up with any kind of a particular guidance on that.
Hey, thank you, Dan. I appreciate your insights. And thanks for being on with us today.